To tell us more about what we can do to stay safe during tick season is Dr. Gretchen Newman, an infectious disease specialist for the Detroit Medical Center. Thank you so much for joining us.
It's my pleasure. Thank you.
So is Lyme disease common?
That's a good question. So not in Michigan. I wouldn't say it's common. Certainly not the way that it's common in the northeastern United States, where we really make the diagnosis. Anytime someone's bitten by a tick, we are very aggressive about how we treat Lyme disease. Here, we see markedly less Lyme disease, much less Lyme.
And how is Lyme disease diagnosed?
So it's a challenging diagnosis to make because our diagnostics are not as effective as we would like. So for example, with COVID-19, we swab your nose, we do a PCR, we know. We can say very confidently yes or no. With Lyme disease, it's still a combination of some lab tests as well as our clinical suspicion. And whenever a doctor says clinical suspicion, what they really mean is we're looking at you, we're looking at the story that you're telling us, we're looking at your exposures, meaning have you been bitten by a tick, do you have the tick, how long ago was it, and then your symptoms. And then the lab tests really only back up what our clinical suspicion is.
Something in that last story kind of led me to believe that Lyme disease can be dormant in somebody. Can you have it and not know because you have no symptoms?
Yeah, so the CDC thinks that about 10% of people clear the infection on their own and have truly asymptomatic Lyme disease. But Lyme disease, like all the diseases that fall in the same category of bacteria that cause them, have a similar pattern. So you have an acute phase, and that's really where the rash comes in. The fancy name for the rash is erythema migrans. The easy name and the way that I want people to remember it is it's a target lesion. So it's a lesion right around the area where the tick was usually that then has a ring that expands around it. That happens a couple days to a week or so afterwards. Then there's an acute phase where some people will feel quite ill with it and even present to the hospital. Then the disease can become latent and if they don't get treated, they can have a restart of their symptoms many years later, in fact, sometimes. That is rare.
Yeah.
That is very rare for that to happen. And we don't want those later manifestations, those later symptoms to happen. They tend to be more severe and harder to treat. And so we want to catch people early when they have just the rash.
Yeah. Now, as a parent, you just horrified me because my son had one of those. So how do you know if it's just a bite versus something that could be worse?
Yeah, you're really looking for it to move. So I have an almost 3-year-old at home. He plays outside all the time. We live in a wooded area. Ticks are a huge problem. So I check him every day. And the tick that causes Lyme disease, the black leg tick, or what most of us grew up calling a deer tick, is really, really small. And so if you're seeing that big old-fashioned dog tick, you don't need to worry about Lyme. But then if you're looking at a bug bite, you're really looking for the inflammation or the redness and the discomfort to not just be that one little area, but to really form a pretty big target around it. Particularly here in Michigan where we don't see much Lyme. You want to really look for the sign for it.
Yeah.
Look for that sign. And then just bring him on into the pediatrician, take him to the urgent care and say, he had a bite, he's been outside, I'm concerned about Lyme.
Okay. What are some ways that you can prevent that from even happening so you don't have to go?
Prevention, an ounce of prevention and all of the rest. So the first thing is making sure that you're wearing long sleeves, long pants tucked into your socks if you're really concerned, and a hat. Light-colored clothing will repel ticks. And then the same bug spray that we recommend for mosquitoes, something with DEET or permethrin, will actually really do the same thing for ticks. The fundamental thing, though, particularly for people who spend a lot of time outside, and particularly for parents of young children, is doing a tick check. So if your kid takes a bath every day, making sure that you're in there looking, making sure that you look over their whole skin so that you're not catching that tick early before it has a chance to bite and certainly become engorged.
Oh gosh, it's scary stuff.
It's one of those things where, yes, it is scary to think about, but at the same time, here in Michigan, it is still quite rare. And also, catching it early is almost, everybody is cured. Fundamentally, with easy to take antibiotics. And so, yes, you need to be aware of ticks.
Yes.
Just like, yes, you need to be aware of mosquito bites and the diseases that can come along with them. But no, we want people playing outside. We want people engaging in the environment. Just do your due diligence on the back end.
Yeah, and just something to keep in mind, ticks are not necessarily just out in the woods. They can be in your yard.
Oh, absolutely. Absolutely. It can be in your yard, but high brushy grass, wooded areas, are the most commonplace. But yes, everybody's yard can also certainly harbor ticks. And we're seeing more with climate change, I'll say that.
Yeah, oh goodness, that's a whole nother
Whole nother
conversation.
topic, whole nother topic.
Dr. Gretchen Newman, infectious disease specialist for the Detroit Medical Center, thank you so much for being with us.
Thank you.